Today I'd like to talk about buttock augmentation. Buttock augmentation is becoming quite popular over the recent years because of the popularity of fuller and round and lifted buttock appearance, and also because of the popularity of buttock shape like Jennifer Lopez and Kim Kardashian's. These round, fuller, and lifted buttocks becoming more and more popular, and people desire to have similar appearances. In terms of making these full round buttocks, the most common way is to inject the fat. When you do the liposuction, we collect the fat and we process this collected fat and then put it back to the buttock area where lack the volume. And this is usually in the middle and outside part of the buttock where they tend to be a little bit flat. So we will inject the fat there so that overall buttock looks fuller. The problem with this procedure is the amount of fat we inject is somewhat unpredictable, and the survival of these fat is somewhat unpredictable. Plus, you need to have the adequate amount of fat to be transferred. So we have to do the liposuction somewhere else, and we need to have enough fat to be able to inject it into the buttocks. So that's because of that, there's some people who is very thin, they probably wouldn't have enough fat tissue to be injected into the buttocks. And also, even if you injected sufficient amount, the survival rate ranges somewhere between 50 to 70%. So not all fat that were injected is going to survive. So you really need to have plenty of donor fat to begin with. So someone who don't have adequate fat, the option will be the number 2, which is the buttock implant placement. And this is implant is made of silastic solid implant, which is essentially they look like somewhat kind of look like a gummy bear, where this plastic is very thick, and so the second option is buttock implant placement. Those people who do not have adequate subcutaneous fat to be harvested and injected into the buttocks have no choice but to augment with the implant. And these implants are made of solid silicone, somewhat imagine like gummy bear, where inside is quite solid. And unlike silicone gel implant, where inside is kind of sticky gel, this implant is quite solid. So there's no problems with the leakage. Is something similar to the silicone gel implant. The problem with the implant is it's going to require incision larger than the liposuction, and we usually place at the midline in the buttock area or just a little off, so that it will be hidden under underwear. And they're usually put under the subfascia, that lining over the muscle of the buttocks, so that it won't move and it won't affect the ambulation. The problem with this implant is sometimes it migrates and sometimes it causes infection, and that will be sometimes it's really problematic. And infection is a relatively high risk in this kind of procedures, and we have to really make sure that the patient who received this implant is well immobilized and well taken care of, and so that we can reduce the chance of infection. The third way, which is somewhat gaining popularity nowadays, is somewhat different procedure, and it's a surgical augmentation. This is typically used for the people who lost lots of weight, or people who underwent gastric bypass procedures and those bariatric surgery, where you lose 50 pounds or even 100 pounds of weight after these surgeries. Because of the loss of the weight, the buttock area becomes so loose and flaccid and saggy, and they need to augment at the same time, needs to be lifted. And in conjunction with the tummy tucks and panniculectomy to remove the extra skin on the stomach, we are offering these type of buttock lifting operation. At the same time, we will stuff the buttock with skin and soft tissue and fat, so that the buttock will be lifted, but at the same time round and fuller. So that's a kind of new wave of surgical augmentation of the buttocks, but limited to those people who lost significant amount of weight. So that's it.